This is Daffy. She's a 14-month-old Labrador Retriever. Yes, that's right, I said 14-month-old lab. That makes her a little over a year at this point. She presented to us for severe elbow dysplasia in both front legs. That means that her elbow joints were not formed correctly from the beginning. She, at this point, has very severe degenerative joint disease in those elbows, and that obviously doesn't stop her from being a happy-go-lucky girl, but her elbows are fused almost completely into a neutral position. She has only about 15 degrees of flexion in those elbows. In other words, she can't flex or extend them much at all. Here you see that she really has to throw her front end forward to move it. Her front legs are very stiff as she's moving. She also has some hip dysplasia, which is not yet turned into degenerative joint disease, but will as she gets older. Here you're going to see Daffy again moving at a little bit faster pace, and now we're taking her into the figure 8 pattern. And you can see even better here that very stiff-legged gait in the front end. She doesn't want to bend her elbows at all, and in fact can't. That hip dysplasia in the back end right now just appears as a little bit of a loose gait. She has just mild arthritis in her left hip, but not significant change yet in her right hip. As she gets older, that'll change, but we're hoping the stem cell helps put that time off as long as possible. We're also hoping to get her a lot more comfort level in those elbows and maybe reverse some of the arthritis there, but we're not expecting it to fix it entirely. We do want to make her more comfortable though, and that's our goal with the stem cell therapy for her. Here you see that she is willing to go for us, but she just physically cannot go faster despite her happy-go-lucky attitude. You'll also notice that she has these very wide tail wags, and that's again to compensate for the hip dysplasia and the discomfort in her front end. You notice she loads a lot of her weight to the back, unlike our other stem cell patients who primarily had rear limb disease and loaded it to the front. Here Daffy's going to go up the steps, and you're going to see that she's slow going up. She's less hesitant coming down, but when she comes down, she has to really place those front legs carefully before she comes down the step. That's because she's having to bear all of her weight in the front end as she comes down, and that's quite painful for her. So she's trying to do it in as least painful a way as possible. And here you see that she really is tiring and doesn't want to go any further for us. We're going to see her come up the step one more time, and you're going to see the care with which she does so, even in her hind end due to the hip dysplasia.